Today I'm ranking the top Medicare supplements to go with in 2025, but stay tuned to the end because I'm going to share my favorite company going into 2025, and it's not what you would expect. When it comes to Medicare supplements or Medigap plans, they are the same. It is a secondary insurance that you can purchase to supplement your original Medicare, which if you don't know, Part A is your hospital coverage and typically won't cost anything per month to have because you worked 40 quarters or 10 years. Part B is your medical coverage, and this year in 2025 is going to cost you $185 a month. Those two together, Part A and Part B, are what they call original Medicare or traditional Medicare, which pays 80% of all your medical and hospital bills. But this is where the Medicare Supplement Plan will come in and cover the rest. All these different Medicare Supplement Plans are categorized by letters, and each lettered plan covers you differently. Now I know that seems confusing, but when you break it down, there are really only two options that make sense and that will add enough value for you to purchase them. Before I break down what the best two Medicare supplement plans are, it's important to know a few things that are going to be the same no matter what supplement that you go with. The first thing is that these supplement plans are what they call non-network plans, meaning they don't limit where you can go to get medical help. So you can go to any doctor or any hospital in the country that accepts Medicare. Another important thing to know about these Medicare supplement plans is that they do not require any prior authorization. So you don't need to receive a referral to go see a certain specialist. One other important thing to know is that the benefits never change from company to company. So say that you took out a Medicare Supplement Plan G with United Healthcare, well, that's going to be the same exact coverage as a Medicare Supplement Plan G with Aetna. But these companies are allowed to decide how much they charge for their Medicare Supplement Plan, which I'm still going to share my favorite company to go with here in a little bit later in the video. Now that you know that, let's take a look at the two most popular Medicare supplements in 2025, which is Medicare Supplement Plan G and Medicare Supplement Plan N. Ever since Plan F stopped being eligible for Medicare beneficiaries back in 2020, Medicare Supplement Plan G has quickly become the most popular Medicare supplement plan in 2025. On a Medicare Supplement Plan G, you are responsible to pay the Part B deductible, which did go up to $257 this year in 2025. After you meet that $257 deductible, the Plan G is going to come in and pick up 100% of your medical bills. So once you meet that, you have 100% coverage the rest of the year. This is what makes Medicare Supplement Plan G the most comprehensive option on the market and the most popular Medicare supplement in 2025. The next most popular Medicare supplement plan is Medicare Supplement Plan N. A Medicare Supplement Plan N is very similar to a Medicare Supplement Plan G on the fact of you still have to meet that $257 Part B deductible. But there's going to be a few differences. So if you take out a Medicare Supplement Plan N, you're going to have two separate copays that you're responsible for. The first copay that you would be responsible for is a $20 copay if you go to the doctor's office. So if you go and see your doctor, you will have a $20 copay. The second copay that you're responsible for is a $50 copay, and you will have to pay this if you go to the emergency room. The biggest difference between Medicare Supplement Plan N and a Plan G is the 15% Part B excess charge. The Part B excess charge is the amount that surgeons and doctors and hospitals are allowed to charge over top of what Medicare says that they're allowed to charge. Although this isn't very common and is pretty rare when you see this charge, we typically see it when someone is diagnosed with cancer. However, that is why you're going to see the Plan N is a little bit cheaper per month than the Medicare Supplement Plan G. Before I share with you my favorite Medicare supplement carrier to go with in 2025, I want to share a couple things that you're going to want to know. You want to make sure that with whatever carrier that you're looking at going with, that you can actually health qualify. These companies will ask a series of medical questions and run a health report when you try to enroll. And in most cases, they do have the ability to deny you coverage if they don't see you being a good fit. But it's also important to know that they cannot deny you. You have guaranteed issue rights to get a Medicare supplement plan with any carrier during your initial enrollment period. This time comes 3 months before you turn 65 your 65th birth month, and then 3 months after you turn 65. None of the carriers can deny you coverage at this certain time. Okay, as I promised, I want to share with you my favorite Medicare supplement carrier to go with in 2025. It's a company called Cigna, and I like them for a lot of different reasons, but here are just a few. I really like Cigna because they tend to take a lot lower rate increases each year rather than some of the bigger named carriers. And if you aren't familiar, every year these insurance carriers are allowed to raise or lower their rates. And from my personal experience, what I have seen, the bigger the name of the company, the bigger the rate increase typically. So typically if you go with a company like Cigna, you're gonna see lower rate increases each year, and after a few years, that's gonna catch up. Now guys, in the comment section below, I would love to know, what is your favorite Medicare supplement? Is it Plan N or Plan G? Guys, thank you so much for watching this video. If you enjoyed it, consider hitting the subscribe button and the notification bell so you never miss a video that we put out. Now go check out one of these videos, and I'll see you in the next one.